This is where our system fails. You think very highly about yourself, but life is not like that.
What's the most heartbreaking thing that you repeatedly see in your hospital?
My heart really bleeds when I come across a young girl who has got rheumatoid arthritis or any other autoimmune condition.
This rheumatoid arthritis RA is also considered as an old age disease. And जब वो किसी ऐसे बच्चों में हो जाती है या फिर middle age के लोगों में हो जाती है, it's usually considered to be like, shh, don't tell anyone. What is the general cause of RA?
Well, rheumatoid arthritis, as we all know, it is an autoimmune condition. So autoimmunity is developed over thousands of years, if you believe in our evolution.
They say health is not valued until sickness comes, but in India, people don't even realize they are sick until the damage becomes permanent. Imagine waking up in the morning and your body stops cooperating. I mean, your fingers just won't open, your knees feel locked, and the worst part is everybody around you is just saying, listen, you're lethargic, or maybe you have some deficiency or old age problem. But what if my question is that your immune system is silently attacking you? Now, today's conversation is not just about joints, but it's about the pain that people are hiding, the disease that they're not talking about, and most importantly, an awareness that India desperately needs. Hello, everyone. This is your host, Shefta Khan, and you're watching another episode of the Health Convo podcast. Now, joining me today with us is somebody who has spent decades over treating people. They have changed lives of so many. Now he's just not solely trusted in India but also globally. Well, he has treated autoimmune diseases, he has treated rheumatoid arthritis. The words will fall short, but I would still like to tell a little about him. Well, he's one of India's most experienced rheumatologists with over 30 plus years of national and international expertise. I mentioned he trained in the UK at St. James University Hospital, Leeds, and Bradford Royal Infirmary. Served as a consultant rheumatologist at Walsall Hospital's NHS Trust for 15 plus years and was awarded the Golden Heart Award 2003, 2006, and 2010, nominated by his own patient. All right, please put your hands together in welcoming Dr. Indrajit Agrawal. Hello, sir.
Thank you.
How are you feeling today?
Very good.
Yeah, that's my favorite thing to ask to a doctor, especially because after a long, hectic schedule, it's a very must necessary question. कोई पूछता है आपसे?
कोई नहीं.
I knew it. Well, jokes apart, Dr. Agrawal, you have spent decades treating joints, firstly in the UK and now here in India. What's the most heartbreaking thing that you repeatedly see in your hospital?
Well, heartbreaking. Well, my heart really bleeds when I come across some young girl who has got rheumatoid arthritis or any other autoimmune condition. But there is so much of apathy towards her treatment, even from their family. I'll give you a small story about a girl who happened to now become a nurse, and her grandparents were not interested in getting her treated. But with my persuasion, and thank God that results were quite good, she pursued her career and now has become a nurse. And recently she got pregnant and has got a child as well. So that kind of things, which I come across, that really breaks my heart, that why there is so much of a gender discrimination that we have in our country.
But what's the point of not going and see a doctor?
Well, I think probably there are many issues, which could be social, but I think primarily they don't want to spend money on the female child.
That's very sad to know about. Usually what I have heard around me and also while reading through these articles, that this rheumatoid arthritis RA is also considered as an old age disease. And जब वो किसी ऐसे बच्चों में हो जाती है या फिर middle age के लोगों में हो जाती है, it's usually considered to be like, shh, don't tell anyone about this. Is it so?
Yes, that is another many stories on that account. I tell you about one lady, who got rheumatoid arthritis, was under my review. But then there are certain medication that you take during rheumatoid arthritis treatment that is not conducive for pregnancy. in a way that that can cause harm to the fetus. So which is why that you need to start sort of stopping and then altering the treatment while she is planning for baby or during pregnancy.
Yeah.
See, the whole idea is that the patients who have married in such a family, see, they want to hide that the girl has got rheumatoid arthritis or any other condition. So consequently, they say that, please doctor, give me something which can last for few months altogether. So then I don't have to show that I'm eating everyday medication because my in-laws or my husband will question. So this is something which I keep encouraging her to, that you should be very truthful about your condition.
True.
But at the same time, I see time and again that this kind of situation arise, and then poor girl, she gets fairly, get a very wrong kind of situation that she is put into, and consequently she suffers silently and sometimes quite badly due to her neglect of the disease and the treatment.
Yeah, true that. Well, what is the general cause of RA?
But rheumatoid arthritis, as we all know, it is an autoimmune condition. So autoimmunity is developed over thousands of years, if you believe in our evolution.
Yeah.
So, say for example, I'll give you about the COVID. What happened that, our body didn't know how to react with the COVID because it was a new virus. So our immune system through many years, they develop certain ways to try to defeat these situation occurring in our system. So this is what we call as an immune system.
Immune system.
So immune system plays a very important role in evading infection, even cancer biology and so many diseases.
Yeah.
But when our body perceive these kind of inflammations as if something has happened and they need to react, and which is when they cross react, and that causes the inflammation, then that causes the tissue damage around it. It could be in the joints, it could be in the lungs, it could be brain, it could be muscles, and so on and so forth. So autoimmune disease, in a simple way, if I have to explain, just like there is an IPL season going on, it is just like a hit wicket. Or in the football, you can call it a self-goal, wherein the person is sort of, has got an inflammation due to the inflammation caused by an autoimmune dysfunction.
That's maybe because of ongoing something in your body that you've been trying to neglect over a period of time, and then something occurs suddenly, and then people try to neglect here in India. And
Well, you are absolutely right. There is some phenomena called genomics and
Yeah.
proteomics
yeah,
and transcriptomes. So these are very important topics for the future. See, what happens that, we are born with billions of genomes, and these can be easily sort of looked at. And these genomes interact with the environment, and through which then we know that, what kind of chemical reaction which will happen in our system.
yeah,
And if that chemical reaction is sort of causing very high amount of inflammatory cytokines, proteins, so that will then cause this disease to happen. So in our your body, my body, or those people around us, they also have these inflammatory substances occurring in their body, but that is in the optimum stage.
yeah,
But if it is, say, for example, it goes very high, then the inflammation will take place. Similarly, in the cancer, it is very important to understand that in the cancer, usually the body tries to stop those cancer cells to grow. But then in certain chemicals, which then, just like, radar. So if there is a aeroplane or missile which hides through the radar, so similarly, same thing happens in the cancer. So the patient's body doesn't understand that, okay, these are some harmful cells which is rapidly growing. So now this is why that this kind of treatment option which will be available will be targeted towards those
particular cells.
chemicals, and then we will have a fantastic results. But I think probably this kind of treatment are still available, but very costly. But in the future, we will develop some technology in our country so that the price will definitely come down.
And definitely we'll have a solution later in the future, hoping for the best, Dr. Agrawal.
Certainly, you can have a vaccination, and then all these problems can be sorted, just like any other diseases that you have. But that is something that will happen maybe in
Later
future.
in the future.
Certainly.
Yeah. Well, Dr. Indrajit, you have spent decades in the UK and now you are in India. There is a negligence in rheumatoid arthritis. Why is it happening in India when we can see so many fast developing cases about RA in the medical field?
See, it is a very important question, but difficult to answer in the sense that what happens in the developed world, either the country gives you the money or
Yeah.
treatment or whatever investigation that are required, or the insurance company pays for it. But in our country, everything has to either go through the government hospital. But we know that government hospital, the doctors over there, I have my friends, they are overworked.
I know.
In, say, for example, I work in Delhi. So, if you just go to a medical OPD on Monday morning in AIMS, there will be more than 20-30,000 people queuing up to see. And how many doctors will be there? Maybe about 10, 15, 20. Just imagine that, how many patients they got to see from morning till whatever late afternoon. So the government hospitals are overburdened.
Sure.
And the private hospitals, this is a conundrum in our country, that in developed world, the private hospitals are meant for those people who have got a lot of financial resources.
Yeah.
But in our country, because there is some deficiency in the system, which is why the patient has no choice but to come to the private sector. And in the private sector, again, there are investigations, they are costly, X-rays, MRI,
Yeah.
they are costly. And then, of course, the treatment, the patient has to buy. So these are the certain things which I feel are important. But having said that, there has to be a referral system. See, in the NHS or any part of the world, the developed world, there are some doctors who are general physicians. So they look after their patients, maybe about 800 to 1,000
Yeah.
patients per doctor. And this doctor is just like a family friend. So he knows about what is happening to the family, who's born when somebody's birthday or whatnot. So these patients first go to their general practitioner. The general practitioners are tuned with the number of diseases that they have, and then they will do some basic investigations, and then the patients will be referred on. Either it will be fast, super fast, and or an ordinary kind of referral. So then the doctor, who is like in a secondary care doctor, like in a specialist, who will be able to understand that this is the disease that the patient has. So, for example, in the UK, I used to get something close to about 70, 80 referrals a day. So, out of which I know that, okay, because some of the patients has got this, that.
Yeah.
So, I will then reclassify my algorithm of these patients, that who comes early, who comes immediately, for that matter, the next day or the same day, and who can be waited for a few weeks.
Acha. Okay. So it brings me to another question, like you just mentioned about the timeline of these patients. For example, who's coming in the first week or who's coming maybe in the last week. Can you just explain it in simple terms? कि weeks का क्या मामला है? Like जो पहले आते हैं उनके साथ क्या इलाज होता है?
Yeah, this is very interesting. Like, these days, some of the diseases, we try to establish the diagnosis in a preclinical stage when there is no symptom whatsoever.
Yeah.
But then you have early disease, and then you have disease, and then the late manifestation.
Yeah.
So if you can think about the early diagnosis, see, for example, patient can have a viral infection or something like that, then they can have aches and pains, but that needs not to be sent to the specialist. So, which is why we call it an early referral. But when the patient do suffer for more than a month with certain symptoms, then that is the point the general practitioner should be able to do few blood tests, and then thereon the patient can be referred. So when we try to see a patient, if the patient can come within first 3 months or within first 6 months or within 1 year, then the treatment will be very successful. So when the patient comes later, maybe 2 years, 3 years down the line, so already the damage, dysfunction has occurred. So unfortunately till now, we don't have much strategy or many ways to treat the deformity of the joints or the complications of the disease. So I keep telling my patient that, oh God, aap yadi pehle aate.
Yeah.
So, all these
Things
very
could
good
have
treatment
been
are
better.
available for
Yeah.
last 15, 20 years. And those patients, if I see some patient having all kind of deformity or complication, just I feel very sad that why this has happened. So I tend to ask them some questions, and then there are situations wherein majority of the time from the patient's perspective, it is somebody who's misguided them,
Okay.
or because of the monetary issues,
Monetary.
or sometimes there are certain neglect from the family. So just I said that female child, they are at the bottom of the queue, or sometimes because somebody is very busy or they don't get the time. So this is certain things which sort of comes times and again when there is a delay in diagnosis and of course consequently treatment.
True that. Thank you for letting us know this. Well, I was having a conversation with one doctor one fine day. He was telling me about a thumb rule. Like you should never neglect a disease more than 3 weeks.
Well, that is very important, but sometimes this thumb rule can be even shorter because sometimes the disease can impact you
In the
within
first-
hours.
Yeah.
So for most of the patients, I agree with you that one should have say symptoms for something. They should sort of go and see the doctors,
Mhm.
but should not become a paranoid. After
Yeah.
all, you need to have a balance
True.
so that you don't waste your time or anybody else's time.
100%.
Okay.
Otherwise, doctors के बाहर सिर्फ line दिखेगी. Just
No. You see, it is very important. The whole idea of coming to this planet is to live and let live.
let live.
And if you call everybody into the hospital, then who will go and see Dhurandhar and whatnot? So why they should go and spend time and money and energy in the hospital? They should do whatever they are up to. Somebody are artist, somebody is a footballer, somebody is a
Yeah.
cricketer. So the life is all about it. In the hospital, we don't want. I certainly don't want patients to come and queue up. I want them to be outside the hospital enjoying their lives.
Sounds very good to me. Now it makes me take me to a question थोड़ा light because हमने बहुत ज़्यादा serious बातें कर ली and I want you also to feel light and everybody around you. They have heard a lot about RA in hospitals. So how do you manage your life?
My life.
Being a doctor, I'm
Yeah.
sure you must be overloaded with work, like you just mentioned. How do you maintain your work-life balance?
I first of all have been a doctor for so many years now, so that doesn't give me any kind of pressure. But as a doctor, what I do that need to be very disciplined. Whatever you do, so you have to get up in the morning and go for a whatever exercise that you have to go and sort of refresh yourself in terms of your academics. I'm always sort of trying to educate doctors. Had a conference recently in Trivandrum just on the weekend.
Mhm.
So we are talking about a condition called lupus. And then I love gardening. So, that is something which I love it. So I have fortunately, I've got a beautiful garden in my house and that I have to maintain in the UK as well. So that is very therapeutic. And then I also have a patch of land wherein I grow some vegetables and all that.
Wow.
So which is why that, I enjoy those kind of stuff. Apart from educating myself and trying to be disciplined and go for work, I tend to work for 8 to 9 hours in a day. Of course, the day becomes very productive in the sense that, I try not to waste any time because there are so many things to do.
Wonderful. That's why we have kept a plant for you. We already knew somewhere कि आपको gardening पसंद होगी.
देखो मुझे कोई प्लांट देता है ना तो
Yeah.
I just sort of make them see the patients come and they give you a damaged car and then this is you who will then sort of dent paint everything and make it beautiful.
Yes.
And then you return back to the family. Similarly, if somebody gives me any plant, I try to make sure that what is wrong with this plant,
Yeah.
why it is not sort of healthy.
Yeah.
I make sure that I read about it, and those people who know me, they give me some books as well to read about it, which is then I feel very satisfied that at least I'm learning few things, and I tell you that it is very interesting, and I just where I've got a farm, I try to take all these farmers around me to Pusa, and they have very very good sort of uh, kind of 1 acre farms. They have tried to introduce in a system wherein the villagers or the farmers who have got a small patch of land, they can grow 3 4 times, and they can make the earning more. You see, because majority of the farmers in our country, they make about say 1 lakh rupees in a year, which is then whether the money will be spent in their whatever treatment or whatever. But you have to make sure that these people are able to make more money through whatever they
They are
have.
doing.
So the skills has to be again improved. So I try my best, but
Yeah.
nevertheless, whether they do it or not, it is up to them.
At least you are putting your foot forward in doing something for the society in the hospital and outside the hospital. Well, I'm
Yeah.
glad to know that.
Well, it is always like you are born here, and then it is my duty or our duty to leave the planet better than for our. Like when you are a lot younger than me, though, I just like any room for the matter. If I use that room, I should make sure that room is better when I left the room.
Yeah.
In a way that our life in here is maybe 70, 80, 90, 100 at the most. So what we have to do is to make a planet better in terms of disease, in terms of education, in terms of productivity, environment, everything.
Yeah.
So I am with it, and which is why I try to do whatever I can in my small way. That I try to say, for example, I go and do a charity clinic 2 days in a month, and I see lots of patients, and I feel very happy and proud about it. That look, government has educated me in the government sector, and well, it is my duty to try to help them out. And how I could have become a doctor if the government has not sort of given me those resources. Like we used to pay only 20, 30 rupees a month. That too in one of the best educational institution called Jipner. It is probably number 2, number 3, or even top at the list. And we had so many good teachers, a good sort of library.
Good sources
So
available.
absolutely. So I feel very proud of my country and that they have. But only thing is that what I can do rather than what others can do. So I try my best.
I hope you have some food for advice to take from this episode. Moving forward, I'm glad to know about it. Frankly speaking, thank you so much. Well, for example, I just want people to understand rheumatoid arthritis in more simpler way. So I'll try to give them an example. I don't have my grandmother right now, so I'll take her example. For example, I bring my grandmother to your clinic, and suddenly she gets diagnosed with rheumatoid arthritis. How would you explain my grandmother in simpler ways so that she doesn't get shocked? Also, she's also able to live her life like how she was living earlier, and the people around them, they are not in the trouble of trying to get things done in a perfect way.
Well, that is very important. That how you break any news.
Yeah.
So this is a very classical scenario. Even breaking bad news. You see, like you need to be empathetic. You need to be sincere. You need to be feeling confident.
Yeah.
You have to explain to them that nothing drastically wrong.
Yeah.
It can be done better. There are a lot of good remedies available, and that can be again used for the effective treatment. And you have a strategy that what is your first priority, maybe the pain control. The second will be how to control the disease, and third, how to prevent the complication.
Yeah.
So if you are very clear about it, and if you try to explain to them that look, nothing has gone wrong too much. You have a disease which has happened. Now we have very good solution, very effective solution. Within matter of 2 to 3 months, if you adhere with whatever I'm suggesting, and hopefully they will just sort of come about it. So, for example, today I was seeing a patient who happened to be in a very bad situation. She could hardly walk. She was being lifted by her grandchildren, and they brought me. And then you see in the review, she was able to walk on her own, and that gives me the satisfaction that look, now she has come around. So there was another story about a patient who was so unwell that people used to start coming and seeing him as if that she is going to not last longer.
Yeah.
But then she came to our attention, we made her better, and then she now enjoys everywhere. And then she asks me every time that how you are. And I say, like, I could be better. But anyway, that is something which is now completely achievable by treatment.
Yeah. And treatment, and like how you just mentioned very nicely, very precisely, how you break the breaking news is also very important.
Absolutely. Absolutely.
Diagnosis is a different thing. Giving them a treatment is another different thing. But for a doctor, again, it's very important how you make the patient understand things. इसलिए मैंने ये सवाल भी पूछा था, because it is a very important part of the journey, because how they are going to live a life is how they are going to explain them how to live a life. As simple as that. So I'm sure for all the doctors who are very empathetic, I'm sure उनको ऐसे MBBS की पढ़ाई में सिखाया जाता होगा. The first thing to do is to be empathetic towards your patient.
But you see, like, this is where our system fails. A way that, majority of the doctors, they go through the MCQ and exams and whatnot. But in other words, you can become a very bright student, but you may have an attitude, you may not be able to function together.
Yeah.
You think very highly about yourself, but life is not like that.
True.
It is like, you have to have a team. Just like in a game of cricket, you can be just a very good, brilliant wicket keeper, but cannot win the match.
Alone.
You have to be absolutely having a team where everybody is putting their best. So I think probably in our country, the stress should be that, how you become a good, empathetic, sincere doctor with a good bedside manner. And which is why that, I feel it is very important that, the students, they get these kind of soft skills, I call it.
Yeah.
Rather than only education. Education is very important, no doubt about it. That is the first priority. But these kind of soft skills in any area of work, be it like, CEO of a company, if he is a very empathetic towards or sympathetic towards his worker, the output of the worker is more. They feel very happy doing the job. Otherwise, if you stress them out, then the productivity becomes very, very less. And there is no point. After all, I always feel that, to make everybody comfortable, be your patient, be your colleagues. So that is how it should be. So I think probably those kind of things are lacking in our system. But I hope that things will improve.
Things will improve. Well, Dr. Agrawal, I've heard a lot about it, that RA strikes women 5 times more than men. Is it because of some hormonal changes in women, or because of their some lifestyle changes, or how they live their life?
Well, you are absolutely right that it is more prevalent in women than men. And if the men gets this disease, they get more severe. So if you get maybe 5 patient or 6 patient female, 1 male will come, and that unfortunately is a bad news for him, because he has to be very particular about his treatment and having a review properly. It could be many things. It could be hormonal, it could be something which is just sort of we don't know. But of course, these things will become even more evident. When I spoke about genomics, when I talked about the transcriptions, when I talked about the proteomics, and so many things, that it is something which we will know in the future. That why it is so, that what happens, that, we are born like a male and female, why certain diseases are more prevalent in men, why some diseases are more prevalent in women. Most of the autoimmune conditions are more prevalent in women. So there must be something which we don't know that is triggering those inflammation. The likelihood will be something to do with the genetics and the transcriptions.
Well, that is something like you mentioned, we'll get to know it in the future. So we leave this question for the future and moving on.
Good.
This is a very interesting question that I have, and I would like to stick to how it is. How many rheumatologists does India actually have per million people, and how does that compare to the UK or the US? And is rheumatology a forgotten specialty in Indian medical education?
Well, you got so many questions. Let me sort of try to recollect and give you the answer. Well, see, till very recently there was only maybe 2 or 3 medical colleges, where the DM, the doctorate of medicine, the super specialization was there. And then, of course, now maybe about 30, 40 odd medical colleges, that they are providing this degree. And the numbers are maybe 2 or 3 in a year. So that means, you have about 40 to 100 people coming out every year in this specialty who have been well trained.
Yeah.
So then a question comes that, this is, our country is a vast country with 140 million, 140 करोड़ जो बोलते हैं हम लोग, तो उसमें से हम लोगों के पास बहुत सारे डेटा नहीं है. So, for example, whenever I go to some places like Bihar, so in Bihar we have only 2 or 3 rheumatologists in the entire state. So the population of that particular state will be probably about 20 million, maybe more. But I think probably if you just imagine that population is more or less close to very big, but how many doctors? So there is a dearth of trained rheumatologists in our country, but hopefully things will become better. But I don't think that we'll be able to evolve into a situation wherein we have thousands and thousands of rheumatologists. What I prefer is that those people who are interested in rheumatology, they should get a basic training for maybe a year or two, and get training under a trained proper rheumatologist, so that they identify the rheumatic conditions, and then they should be able to treat the patients, and if they are not able to, then they can refer on to a rheumatologist. So I think probably this, what we call as a bridge education or fellowship or whatever, is very much important for our country, because we will not be able to produce so many doctors or super specialists in 2 years, 3 years, 5 years down the line. So there has to be some strategy. Having said that, if it is a forgotten specialty, the question is the allocation of funds. When we are a developing economy, the stress will definitely in the education, health, defense, and so many other areas. But our health budget, which has been increased only recently a little bit, but the per capita income and GDP growth and the allocation of funds towards medical is still a lot less.
True.
And out of that, those save what of money, majority of the money will go towards maybe cancer, maybe cardiovascular disease, maybe something else, women's health, child health, vaccination. So, I think probably if the pot of money is small, then again, the priority has to be different. So I used to be a clinical director of my hospital. So when I was just only a consultant, I used to be an activist. But when I changed my role as a person who holds a budget for entire community, then I realized that, look, everybody has to have a stake in it. And then there are certain priorities, and all are very important, but you have to prioritize. And I think probably people who are related in the health economics, they should look into it. They should sort of, engage with the specialist. And then we should have just like, we have got now, we are doing census studies. So I hope that if they could get certain diseases as well. So until unless we have the diseases that what are prevalent, then only we can allocate the fund. That is very important. If you don't know the magnitude of the problem, then how can you sort of put money into those areas?
100%. Well, like you just mentioned about the specialists in this field, there are very less compared to the amount of people that we have in our country. There are very many patients who first likely to visit orthopedic surgeons or maybe general physicians and maybe even neurologists before actually coming and seeing the actual RA doctors. So what is the common misdiagnosis that you see in a patient?
Well, first of all, let me correct you. We are rheumatologists. Rheumatologist. Okay. Yeah, this is something, when I speak to the general population, that what I do, first of all, I'm a doctor. And then they ask me, okay, what sort of specialty do you? that I do rheumatology. So what is rheumatology? Then I have to explain to them, the गठिया जो होती है ना उसके डॉक्टर हैं. अच्छा अच्छा आप सर्जरी करते हो नहीं की, तो then I have to say नहीं, जैसे न्यूरोसर्जन होते हैं न्यूरोलॉजिस्ट, उसी तरीके से ऑर्थोपेडिक सर्जन और मैं रोमेटोलॉजिस्ट हूँ. मैं बिना ऑपरेशन के दवाइयों से ही पेशेंट की ट्रीटमेंट करता हूँ. सो दैट इज हाउ आई ट्राई टू एक्सप्लेन. But having said that it is sometimes little unethical that if I don't know how to operate a heart, then why should I keep those patients under my patch? I should have to refer on to the cardiac surgeon. Similarly, those patients who are seeing a general physician or an orthopedic, if they feel that they are able to deal with the patients comfortably and they are able to get a good result, then they should continue. I think that is what I was just explaining. But those patients who are not doing well in that kind of treatment, what they are receiving, then they should refer on. And unfortunately here, they have Jola Chap doctors, and then you have some MBBS doctors, and then you have some others who are also practicing. And unfortunately, majority of the patient with autoimmune diseases, rheumatoid arthritis, lupus, they get nothing else but steroid and some painkillers, which in a long term can be very dangerous, and which is why that it needs to be stopped. Well, why it happens? The problem is again money. You see, the steroid or the painkillers, they don't cost much of money. If you take it, maybe you will get a relief. Just like if you take crocin, your temperature settles down. But it doesn't make you better in terms of whether you have tuberculosis, whether you got typhoid, whether you got UTI. But that needs a specific treatment. So steroid and painkillers just gives you a symptomatic relief. But it doesn't cure your disease or try to, have a disease under control.
100%. Happens with all of us. कुछ भी होता है, we try to take any medicine that's lying in our first aid box. Easy. और थोड़ा मॉनिटरी भी हमारे लिए आसान होता है.
Well, I think probably that is something which is very much there in our psyche. Say for example, sometime I see a patient who said कि मेरे को जो सिम्टम थी उसको भी वैसे ही थी. तो हमने अपनी दवाई से उनको कुछ दे दी और वो भी ठीक हो गया. डॉक्टर साहब आपकी दवाई तो इतनी अच्छी है. तो मैंने कहा कि भाई ऐसा नहीं करना चाहिए. मैं तो उनको मजाक में बोलता हूँ, तो आप तो मेरी रोजी रोटी छीन लोगे, लेकिन ऐसा नहीं होना चाहिए.
हमें सिखाया गया है और अच्छे से बताया भी गया है, eat apple every day keeps the doctor away. So we try to keep doctors away from our houses and lives, ताकि क्योंकि उनके पास जाते ही there is a bill long खर्चा that they give us to, and it's a never ending process then.
नहीं, देखो डॉक्टर्स को भी ना पेशेंट से ठीक से बात करनी चाहिए और उनको समझाना चाहिए, और हो सके तो कम से कम दवाइयाँ लिखनी चाहिए और कम से कम इन्वेस्टिगेशन करनी चाहिए. तो होता क्या है ना कि आजकल बड़ा एक माहौल ऐसा बनता जा रहा है जिसमें you feel कि doctors have become vilified, and I think probably to a certain extent there is a problem in the society. तो मुझे लगता है कि वो तो आपको खुद ही रिफ्लेक्ट करना पड़ेगा कि मैं कैसे क्या करूँ, क्योंकि कोई पेशेंट यदि गरीब है तो आपको सारी चीज़ें आपकी ये जो क्लिनिकल एक्यूमेंट लगानी पड़ेगी कि मैं कम से कम उसको इन्वेस्टिगेट करूँ, मैं उस सारा पैसा उसका ट्रीटमेंट में डालूँ.
I love it already. I could imagine you sitting in your clinic and the patient is coming to you and saying, I don't have money. So you are only trying to focus on those specific things कि ये बस इतना ही चेक करा लो. I'll try to figure out कि इसमें क्या हो सकता है.
आज ही मैंने एक पेशेंट को देखा तो मैंने कहा कि देखो बेटा, अभी तुम्हारा मैं इन्वेस्टिगेट नहीं कर रहा हूँ और तुम करना भी नहीं, क्योंकि अभी तुमको जरूरत नहीं है. यदि कुछ दिक्कत होगी तो मुझे बता देना. तो इट गिव्स यू अ लिटिल बिट ऑफ एक्स्ट्रा केयर कि आपको थोड़ा रिव्यू जल्दी करना पड़ेगा. तो कभी कभी देखो यहाँ पे हम लोग वी आर इन दिल्ली, सो देयर आर लॉट ऑफ एफ्लुएंट पीपल एज वेल, एंड देयर आर सो मेनी पीपल हु वांट्स टू जेन्युइनली हेल्प योर पेशेंट्स. तो मेरे पास देयर आर ग्रुप ऑफ मे बी अबाउट 30 families who are very much willing to come and help us out. I'll just give you a small story. Recently I had a patient जो कि 4-5 दिन पहले की बात है, इसलिए मेरे दिमाग में बड़ा फ्रेश है, क्योंकि वो छोटी सी बच्ची है, बड़ी प्यारी सी बच्ची है, उसको सीवियर रूमेटॉइड आर्थराइटिस है और उसके पिताजी को अनफॉर्चुनेटली ही वाज इन आईटी सेक्टर. अभी चूंकि आईटी सेक्टर में प्रॉब्लम चल रही है तो उसकी जॉब लॉस हो गई और उसके बाद फिर क्या हुआ कि उसको फिर एक कैंसर हो गया और वो बेचारा अभी ही इज ट्राइंग टू सॉर्ट ऑफ गो थ्रू हिज कैंसर ट्रीटमेंट. तो वो जो बच्ची है, he she was just looking and staring at the vacant space, और डिप्रेस हो रही है. She is not able to come to terms with her situation in the family. तो मैंने दोनों की तरफ देखा. मैंने बोला कि आप चिंता मत करो उसके फादर को, कि मैं हूँ, मैं उसका ट्रीटमेंट जरूर कराऊंगा, चाहे कुछ भी हो जाए. तो मैंने अपने से अभी अभी उसको कुछ ट्रीटमेंट दिया, और फिर मेरे कुछ फ्रेंड्स हैं तो उनको बताया कि देखो ये स्टोरी है. सो देर आर लॉट ऑफ पेशेंट्स हु हैव गॉट दिस काइंड ऑफ फाइनेंशियल सिचुएशन. तो हमारा ये फर्ज बनता है कि मैं कभी कभी पेशेंट को बोलता हूँ कि आप ले जाओ, जब पैसे हो जाएंगे तो दे देना. And then you see 99% of the time the patient will pay the money. They are not, I think probably this is something which I have seen time and again.
Is it? Otherwise यूजुअली सोचते हैं कि if we are helping others, हमारा कुछ चला जाएगा. We'll be left with nothing. But people like you, again, we have in our society. And doctor, I'll tell you something, whatever you are doing with your patients, whatever you're contributing in the society, things are gonna multiply 10x. I know you know it, but I'm just saying it. Things will multiply 10x and will come to you in a better way possible.
देखो, उसका तो हम नहीं उसके बारे में सोचते. मुझे तो यही लगता है कि भाई मैं डॉक्टर तो बना होता है इसलिए ना, कि पैसे तो बाय प्रोडक्ट है. जैसे मान लो क्रिकेट आप खेलते हो तो बड़ा अच्छा क्रिकेट खेल लेते हो तो पैसे आ जाते हैं.
Yeah.
उसी तरीके से आप यदि अच्छा काम करते हो तो पेशेंट तो पैसे दे ही जाते हैं, है ना. तो उसमें कौन सी बड़ी बात है. तो आई थिंक प्रॉब्ली वन शुड नॉट एस्पायर दैट ओके. और सबसे इंटरेस्टिंग चीज़ थी कि मैं इतने साल बाहर रहा ना, तो मुझे बड़े पेशेंट्स लाइक करते थे वहाँ पे. और वहाँ पे तो है ना कि आप कि जो प्राइवेट सेक्टर में जो पेशेंट्स को मैं देखता था तो उन लोगों की फ़ीस बहुत ज़्यादा थी. और सम टाइम बहुत साल पहले ही हम लोगों की फ़ीस बहुत ज़्यादा थी. तो इन ए वे दैट यू फील कि आपको ठीक है, सब चीज़ तो मिल ही रहा है, और आप क्या खा लोगे. मतलब वही सूखी रोटी और थोड़ा सा कुछ, और उसके बाद में आप यदि डिसिप्लिन नहीं रहो तो फिर आपका बहुत सारी डिजीज़ आपको आ जाएंगी. तो यू गॉट टू बी वेरी केयरफुल दैट हाउ मच यू शुड सॉर्ट ऑफ have your requirement, और उसी के हिसाब से अपना काम करते रहना चाहिए. लेकिन आई थिंक probably some people they just sort of get into the situation of having a car which is like a car, okay, but they want to have something which is bigger and better, and then it becomes like a situation wherein you have forgotten why you became the doctor.
It becomes a never-ending loop for you once you get into it. Fantastic. Well, I'm gonna take you somewhere off the topic, and what I can actually guess it from your conversation is that you've mentioned cricket 3 times, and we have just reached 50 minutes of a podcast. We have not done it yet. I'm guessing that you're a big time cricket fan.
Well, I do like all sports, but cricket is definitely one of the sports which is very much. I used to go and watch cricket, especially when Tendulkar was playing, and I like Virat Kohli's game as well. But you see, like I follow some amount, but not much. But I like all the sports. Like I used to go and see some football matches in the UK as well. I used to go and watch some Wimbledon, good tennis as well. So it is just that I feel like how brilliant they are, in terms of their skills, and that is something which sort of completely. I just feel that look, they may not be highly educated, but they got so much a presence of mind that how to play the shot, how to sort of put it across in a way that they have sort of figured it out in a matter of few milliseconds. So that is something that you have to admire. That how reflects their good sort of sports personality that they have. So hats off to them.
Yeah. I realized that you have mentioned in a conversation once, and I can completely agree with like how discipline doctor plays a very important part of our life. Not every time education is important. Yeah, it can take you somewhere, but maybe the way you are disciplined in your life has taken you till here, has brought you till here. But like how cricketers, how they are disciplined in their life, waking up in the morning, doing the things exactly at the right time. That is why we all admire them at the same time.
Well, of course, for success, there are many things, but hard work, discipline, learning skills, always, trying to be a student all the time, without having an attitude issue, are very important. If you do work all these things together, and you need to be a little bit lucky also, in a way.
Yeah,
That,
I agree.
say for example, if you read a topic and then the next day your exam question paper, that is the same thing, which then you are lucky. So
Yeah.
that luck also comes if you are positive towards many things. So I think probably combination of everything that has to happen. uh, you you cannot be always unlucky, you cannot be always unlucky. So this is something which is that in between, that you have to have this discipline, skills, able to work together, those kind of attitude, soft skills.
Beautiful. Thank you so much for letting us know that.
Mm.
All right, then, moving on. Dr. Agrawal, can you just walk us through the treatment ladder of this disease, be it autoimmune disease or rheumatoid arthritis, for a person who's watching it for the first time and they're thinking, हो सकता है शायद मुझे भी ये disease हो, and they have a question popping up in their head. बाकी सारी चीजें बाद में, पहले ये बताओ कि खर्चा कितना होगा, starting till end. What is the treatment like ladder?
That is very difficult to answer. First of all, you need to make sure that the patient has got that autoimmune
Yeah.
disease, be it SLE,
Yeah.
be it rheumatoid, be it anything like Angstmond or whatever. So then it comes like, how to go about it. And then you see, like, if you are an experienced doctor, then you should be able to cut and paste and do something so that you can make pocket friendly treatment for that particular individual. That is when the skill comes, so you have few people who have got a lot of money and resources, and then you have got 70% of them who have got barely some amount of money where they can barely have some treatment. So you have to make sure that you understand the patient, make sure that what they're up to, what kind of educational background that they have, what kind of monetary background that they are coming from, and then you have the chance to again reflect on it and treat according to whatever the resources that is there in front of you. So I think probably if you get it right, then the treatment will be successful. Because if you write a tablet or treatment investigation, if it is not affordable, then how can they just sort of think about it? And then you need to also make sure that, say for example, today only one patient came from Nepal. So he heard about me and I said, okay, you came all the way, so let me try to help you. So I try to make sure that if I can save some money for this lady and her son, so then I'll be at least be able to save some amount of transportation money. So in a way that you have to be always very sure that how much you can save for the money for the patient. But if you are working in the government setup, this kind of question doesn't arise. But because every investigation, every treatment is free, but the private sector, everybody has to pay for it. So which is why then you have to think about how to minimize the impact of burden, financial burden onto your patient.
Okay, okay. So ये तो बात हो गई financial monetary चीज, okay. But if we talk about the process, like how much time does it take for a patient? I'm sure again ये patient to patient depend करता
Yeah,
होगा.
yeah.
But एक अगर हम average लेके चले for a person who has just got diagnosed and is worried कि यार ठीक है अभी इसमें बताओ टाइम कितना लगेगा, मैं कब तक ठीक हो पाऊंगी या हो पाऊंगा?
मैं यूजुअली सबको 2 से 3 महीने का वक्त देता हूँ, एंड जनरली तो पेशेंट यदि अर्ली डिजीज में तो वो तो 10 दिन के बाद ही ठीक हो जाते हैं। लेकिन जो 10 दिन के बाद ठीक हो जाते हैं ना, तो देन दे टेक इट वेरी लाइटली। सो मैं उन लोगों को बोलता हूँ कि भाई देखो, अभी ठीक तो आप हो गए, लेकिन आपको दवाई खानी पड़ेगी, नहीं खाएंगे आप तो फिर आपको फिर से नुकसान हो जाएगा। लेकिन पेशेंट है, वो आखिर क्यों सुने, उनको लगता है कि ये दवाई क्यों खाना। तो यहाँ पे एक और सब बड़ा सिचुएशन है ना कि एवरीथिंग दे ब्लेम ऑन टू द टैबलेट्स, और उसके बाद द डॉक्टर। तो मैं तो सबको मजाक में बोलता हूँ कि हाँ, अभी अमेरिका और ईरान में जो लड़ाई हो रही है ना, आपने दवाई खा ली इसीलिए शुरू हो गया लड़ाई। तो वो हम लोगों को थोड़ा सा तो लोगों को डांटने से कोई फायदा नहीं है। यू हैव टू मेक देम सॉर्ट ऑफ अंडरस्टैंड दैट व्हाट दे आर टॉकिंग अबाउट इज प्रॉब्ली नॉट ट्रू, लेकिन आपको समझा के ही बात करनी है।
True that. Can you share like one experience from your life journey चाहे वो यूके का हो या फिर इंडिया का हो, where the story was much heart touching for you personally. You must have some done changes in your life कि कुछ तो बदला होगा आपकी लाइफ में उस पेशेंट के ठीक होने के बाद या नहीं होने के बाद, कुछ ऐसा.
मेरे पास तो शायद मैं बहुत सारे फिल्म का स्क्रिप्ट लिख दूं लेकिन अभी ऑफ द हैंड तो मैंने आपको छोटी बच्ची के बारे में बताया जिसका
Yes.
ओके है.
Yeah.
उसी तरीके से कुछ दिन पहले एक पेशेंट को देखा था जिसको बहुत सारे अल्सर्स थे पूरे बॉडी में, और उसकी कुछ देख के लग रहा था कि दिस मे नॉट बी ऑटोइम्यून. अब वो पेशेंट बेचारा रेडी पटरी लगाता है, मैं उसको बोलूँ कि भैया ये कर लो, वो कर लो, ऐसा कर लो, वैसा कर लो, तो वो पॉसिबल ही नहीं था. तो मैंने कहा कि चलो आपको ये मैं दवाई देती हूँ. वो ट्यूबरक्लोसिस की ही लग रही थी मुझे, क्योंकि ट्यूबरक्लोसिस ऑल्सो कैन प्रेजेंट इन मेनी वेज. एंड फिर फिर गवर्नमेंट से फ्री में टीबी की दवाई मिलती है, तो दैट इज़ ऑल्सो वेरी गुड. तो वो दवाई खा लिया और उसके बाद फ्यू मंथ्स के बाद उसके सारे अल्सर वल्सर हील हो गए. तो मुझे बहुत सारे पेशेंट, कभी कभी मैंने देखा है कि डॉक्टर्स कभी कभी ठीक से एग्जामिन नहीं करते, या हो सकता है कि वो लोग बिजी होंगे, हो सकता है कि वो लोग ज़्यादा इन्वेस्टिगेशंस पे बिलीव करते हैं. तो आपको क्लिनिकल एग्जामिनेशन, क्लिनिकल हिस्ट्री टेकिंग बड़ी इंपॉर्टेंट है. तो मैं आपको बता रहा हूँ कि एक पेशेंट मेरे पास आई, तो उसको कुछ प्रॉब्लम थी, तो उसको बताया कि ऑटोइम्यून डिजीज़ है. जब मैंने हिस्ट्री ली तो मुझे लगा कि वो ऑटोइम्यून डिजीज़ तो नहीं लग रहा है. तो फिर मैंने जब उसको एग्जामिन किया तो द स्टोरी वॉज वेरी डिफरेंट. तो मुझे लगा कि वो पेशेंट को कैंसर है, एंड इनफैक्ट द पेशेंट को वो कैंसर ही था, विच वॉज प्रेजेंटिंग लाइक मेनी वेज. एंड वो पेशेंट ने मुझे चिट्ठी लिख करके, मैं बहुत ज़्यादा मतलब कि इमोशंस और इससे मैं हटके रहता हूँ, क्योंकि देखो हमारा काम तो प्रोफेशनल है. द मेन आइडिया इज़ टू ट्राई टू हेल्प एवरीबडी एज मच एज यू कैन. तो वो मुझे हमेशा लिखता रहा कि आपने, ज़िंदगी तो खैर उसकी नहीं बची, लेकिन आपने जो किया हमारे लिए वो बहुत सही था, और जो भी था तो बहुत तरह तरह की स्टोरी है. आई थिंक प्रॉब्ली दिस लाइक व्हेन यू आर like become senior, you become a good storyteller because you got so many stories, like almost every few days you got some story about it. You can just write a script of the movie. But it is a human thing. There are a lot of emotions, there are a lot of suffering, there's a lot of enlightenment, there's a lot of elatedness, there's a lot of satisfaction. So it's just like masala, wherein you have many things which comes on your way on a day-to-day practice, and you have to take it as a challenge. You have to always think that probably if I don't make the best out of it, but at least I should make things more suitable, so
Yeah.
for the patient and their family. So यदि छोटी सी बात से यदि पेशेंट की फैमिली को या पेशेंट को भी आप थोड़ा मदद पहुंचा देते हो इमोशनली, तो मुझे लगता है कि वो बहुत बड़ा काम हो जाता है बहुत सारे सिचुएशन में.
Yeah, it's important to calm them down in the initial phases. फिर बाद में तो treatment चलता ही रहता है. It's again a very big process. But I like what you're doing in the early stage. Also, I have one question in my head and it's just not going. Does this also affect your lungs, liver, kidney, brain?
You are right. This is what we call not only the joints but other structures. Say, like we have got these damages can occur. Say, for example, there is a lot of interplays of rheumatoid arthritis with eyes, with the lungs, with the nervous system, with the brain, with your heart, and so on, muscles. So, in the initial stages of disease, you have to first of all examine the patient thoroughly. If needs be, then you have to appropriately investigate them. And whenever you're reviewing, you're not only talking about their joints, but you have to talk about, discuss about their eyes, maybe dry eyes for that matter, some redness in the eyes, in the lungs, shortness of breath. If they are short of breath, what could be the problem that is associated with. It could be interstitial lung disease or something like that, nervous system involvement. So I think probably you got to be very careful about what is the patient suffering then. Not only the joint issues, but other, what we call extra-articular manifestation of the diseases.
I can see that. I can feel you. I mean, the life of a doctor is not easy. मतलब जो patient एक बीमारी लेके आ रहा है, उसके अलावा भी you guys are like dealing with so many things. इसके अलावा अच्छा ये problem तो नहीं है, अच्छा वो problem तो नहीं है. Just to take care of the patient's proper health body. which is commendable.
I think probably this is the training, and I think probably majority of us, whichever, if you are a cook, you need to be very passionate about your cooking. You have to have a best result in the given situation. आप ये नहीं कह सकते कि मेरे पास तेल नहीं है या घी नहीं है या मेरे पास सब्जी नहीं है. So whatever you have, you have to make the most of it. That is what you need to do in any day, anything. Whatever you are up to, you have to make the best situation out of whatever that is thrown in front of you, and that is what the training is all about.
Amazing. Love it. Okay, so we have come to the last lap of our podcast episode. Jate jate, I have many questions, but I'll meet you until next time for that. Or maybe I'll have some private conversations with him because there's so much to learn from him. Oh my God, he's a pool of knowledge and discipline. But for somebody who's living a normal life like me, so how am I supposed to live my life? Like, what all things am I supposed to do in my day-to-day life, and what things I should really not avoid and just not do it? Because autoimmune diseases, they just occur. ऐसा कोई solution और ये किसी का जड़ नहीं पता. But again, lifestyle बहुत matter करती है for patients who are suffering from autoimmune diseases. So can you just break down the kind of life one should live?
Well, the first thing is, again, discipline in everything. If you are to eat, why you should eat unnecessarily. Say for example, I don't have very hectic sort of, physical work. So my calorie requirement is not that much. And then majority of the time I have to sit down because, I can't be just walking about all the time. So, I do have to understand that my calorie requirement is less. So consequently, you need to make sure that, you eat less, you eat as much as is required. You need to do exercises. You need to make sure that, you sit down with a good ergonomics, you call it, when your sitting is comfortable.
Okay.
You got a backrest, you've got a table and chair, which is conducive for a long sessions. You need to take breaks. There's that kind of discipline that you have, and then you need to be aware of it, and you should sort of speak to somebody who knows about certain aspects of it, a trainer or a physiotherapist who will be able to guide you through in the early stages of that. So I think the worst situation is that what we call lifestyle diseases. If somebody can master all these things, how to be disciplined, how to do work, you cannot just blame that long many hours, and which is why I don't get time to, those are nonsense. You have to do it. This is your health. So, you need to make sure that you do adequate rest in the night, sleep well. There are a lot of people, they just feel that, they need to be working till very late night. Maybe that, a specific scenario situation that demands it. But by and large, if you're regular, maybe 8 to 9 hours, a day, it should not be 14 hours. That kind of, rubbish that somebody talked about, that what you do in the hospital, in the home, looking at somebody's face, that should not be. Life is all about living. This is a part of it. Your work. You should have your hobbies, should have your friends. You should so have a set of something that, emotions, you need to go and spend some time with your kids. That is what all life is about. It is just not that, trying to just make only work. That is not right. That is definitely not right. But that is also not right that, you just spend only sort of gaming and doing all kind of unproductive thing. So that is also not right. So you have to make something out of it.
True that. 100%. I completely agree with you. So one time I was just telling my friend the difference between a successful man and an unsuccessful man is because the life that they're living every single day. The way they're living becomes a habit, and the habit becomes a routine, and that makes a man, how they are. So I think that's a beautiful thing to start with, to live your life, and like how you mentioned, I truly agree with it. Okay, so moving on, I have a quick rapid fire for you. It will take 1 minute, and you have to quickly answer. Okay, it's gonna be fun.
Okay.
One food that you will tell every Indian to reduce to protect their joints.
Sugar.
One habit that RA patients should start tomorrow.
Exercise.
Is it? One thing you wish Indian medical colleges taught differently about autoimmune diseases.
I would suggest that empathy and sympathy towards their patients.
Love it. One message for Indian women who put everyone else's health before their own.
Well, that is, you cannot change it because this is the way they are born and this is the way they're brought up with. But they should look after first themselves in order to help somebody else.
Okay, send
Just
me.
like you have in aeroplane, they say that before you aid somebody else, you got to first wrap yourself.
Perfect. Sending this right away to my mother. Okay, last question for you is, if you weren't a rheumatologist, what would you have been?
I would have been very much an agriculturist because this is something that I would have loved.
Yeah.
Because just digging the ground and making sure that the plants are kept in the best health.
I can imagine you already doing it.
I do.
Perfect. That was it. Thank you so much. It was lovely having you, Dr. Indrajit Agrawal.
Thank you.
I thought it would be more like towards clinical side, but the conversation that we had was truly needed by me and for our audience together. So
Yeah, the last bit of thing what I would suggest about autoimmune diseases is that this disease is fairly prevalent in our society.
yeah.
One should not panic about it. Go to the rheumatologist. So they will be able to put you through the different kind of history and investigation management plan then will happen. And these days, by and large, we have very successful remedies. And that is the best thing is that in our country, what we are able to give you treatment is in much, much lesser pricer than what it is there in the developed world. For example, there is a drug called upadacitinib. So that costs about more than 1.5 lakhs in UK or in the US. But for us in our country, we produce it in less than 2,000 rupees per month. So that is where India is all about. We can have very good treatment in fraction of the cost that you have in the developed world. So there is a important thing that one should not just say that okay अब तो ये disease हो गई तो मेरा सारा काम खत्म नहीं. वहाँ से आप शुरू करो और वहाँ से आप अच्छे से अच्छे ट्रीटमेंट लेकर के अपने आप को भी हेल्प करो और दूसरों को भी हेल्प करो.
Beautifully said it. Well, on that note, I would say thank you for being a part of this podcast, of this episode, and it was wonderful having you here with us today. Thank you.
Thank you. I look forward for your next invitation.
My pleasure. Thank you,
All right.
Doctor.
Thank you.